that recorded. All right, thank you guys. Sorry about that. We were dealing with some email issues. So we will get started. So thank you all for attending our Pathways to Wellness Accessing Care webinar series. This webinar series was put together with the goal of addressing knowledge gaps of all individuals, regardless of insurance status. And so today we will be talking about Medicare. I'm going to just do a couple intro slides and introduce our speaker. Oh gosh, I can't. Okay. Oh, maybe that's not yes. Okay. So just some disclaimers before we get started. The views and opinions expressed in this webinar are solely those of presenters and do not necessarily reflect the official policy or position of the Health Council of West Central Florida. The information in our webinars and e-materials, digital recordings, and other materials like our resource list is for general information and educational purposes only and should not be construed as an endorsement, recommendation, or promotion of any specific person, company, product, or service. And nothing contained in these materials is or is intended to be construed as advice. We are only providing you with techniques, tools, information, insights, and educational material to assist you in your personal life and navigation of accessing care and or health insurance. So a little intro on our speaker today. So we have Jim Tolbert. So Jim is the SHINE Volunteer Area Coordinator for Planning and Service in Area 6, which covers Hillsborough, Manatee, Polk, Highlands, and Hardee counties. Jim has been an active volunteer counselor with the SHINE program since 2011 and lives with his wife, Claire, in Lake Placid. In April 2011, Jim retired from a 42-year career in human resources. The last 20 years of his career in HR was he was a manager for the Allegheny County Sanitary Authority in Pittsburgh, Pennsylvania. So thank you, Jim, for joining us today. I will stop sharing and allow you to share your slides and get started. Let me
Okay.
know
If I can start my video here, it says you cannot start your video because the host has stopped it.
I don't want the power to, well,
It doesn't matter. I can share my screen here. Let's see. Uh, let's see. Share
it just
screen.
need to give me the option to make you show your camera, so I'm not sure.
The camera's plugged in. I don't know what the problem is, but anyway, there's the presentation. And let me do slideshow from the beginning. Okay. So, can everyone hear me okay?
Yep.
Okay, very good. Thank you, Ismary, for this opportunity. I'm pleased to be with you today to do this presentation that we call Medicare Basics. First, I want to tell you just a little bit about SHINE and what we do. So SHINE is a volunteer program sponsored by the Florida Department of Elder Affairs. Funding for the SHINE program and similar programs in every state, which are called state health insurance programs or SHIPs, is provided through grants from the Department of Health and Human Services. So every state has a SHIP. It's called various things in other states. In Florida, we call our SHIP program SHINE. So SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. Now, the Department of Elder Affairs has a broader responsibility, so SHINE is just one of their programs. SHINE is free. It's offered by the Florida Department of Elder Affairs in partnership with your local area agency on aging. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Now, the Department of Elder Affairs has divided the state into 11 areas. In each area, the Department of Elder Affairs contracts with a not-for-profit agency to operate what's called an Area Agency on Aging or Aging and Disability Resource Center to serve that part of the state. So in our area, which includes Hillsborough, Manatee, Polk, Highlands, and Hardy counties, the ADRC services are provided through the Senior Connection Center, which is a not-for-profit located in Tampa. Now, on your screen, you see a statewide toll-free number, which is 1-800-96-ELDER, E-L-D-E-R, or 1-800-963-5337. If you call that number from a Florida area code, you're routed based on the area code you're calling from to the appropriate Aging and Disability Resource Center. Once you reach us, you have various options. One of them would be to speak with a Shine counselor, but there would be other options in case you needed something else, such as information about home delivered meals or senior housing or legal assistance, or you wanted to get on the waiting list for government programs that help with long-term care costs. These would all be things that the Area Agency on Aging would be able to help you with. So what does Shine do? Well, we counsel people mostly over the telephone, but also face-to-face at various counseling locations in the counties we serve, places like libraries and senior centers. We answer people's questions about Medicare. We explain the two different ways that you can get your Medicare, which is what we're going to talk about today. That would be Original Medicare or Medicare Advantage. We can also help people pick specific insurance products to meet their needs. For people who prefer Original Medicare, we can help you select a cost-effective Medicare prescription drug plan based on the medications you're taking, and also a Medicare supplement or Medigap policy. If you prefer Medicare Advantage, we can show you all of the Medicare Advantage plans that are marketed in your county and help you pick one, again, based on your medication and the providers you want to see that will work for you. We also screen everybody that we talk to see if they may qualify for state and federal programs that help with some of the drug costs. We're going to talk more about those programs later in the presentation. We also can help if you need to file a complaint about the service you've received from a Medicare provider, or if a service is denied and you need to file an appeal. And finally, through what's called Senior Medicare Patrol, or SMP, we have a role in preventing, detecting, and reporting Medicare fraud and abuse. Now, in our presentation, we're going to have an introduction to Medicare. We're going to talk about the parts of Medicare, how you enroll in Medicare and change different Medicare-related programs. We're going to talk about government financial assistance programs that help with the Medicare costs. And we're going to talk about how to prevent, detect, and report Medicare fraud and abuse. So, what is Medicare? Well, Medicare is a federal health insurance program for eligible individuals. Unlike other insurance that you may have had, you can't just add your family members. Everyone has to qualify on their own. Eligibility is not based on income. It's for people 65 and older or with disabilities. And it's administered by the Centers for Medicare and Medicaid Services, or CMS. For most people, enrollment in Medicare is processed through the Social Security Administration. The exception would be people who retired from the railroad, and they would apply through the Railroad Retirement Board. Now, people confuse Medicare and Medicaid because they have similar names. Medicare, again, is federal health insurance for eligible individuals. It's not based on income. Medicaid is jointly funded between the states and the federal government. Medicaid is run by the states. Every program is a little different. And it's based on income, largely, income and resources. And it's designed to help people with medical costs also, but primarily lower income folks, both 65 and older or disabled. So some people have both Medicare and Medicaid. So Medicaid does cover some services that Medicare doesn't cover, and it is a secondary payer for those people to Medicare. Medicare will pay first, and then Medicaid will pay the normal patient responsibility. So again, Medicare, to be eligible for Medicare, you have to be a United States citizen or permanent legal resident who has lived in the United States for 5 years. You also have to either be 65 or older, or if you're under 65, you have to have been collecting a Social Security disability benefit for 2 years, or have end-stage renal disease or Lou Gehrig's disease. Now, I want to talk about enrollment periods and signing up for Medicare and Medicare plans. Now, first of all, we have what's called the initial enrollment period, which is a 7-month period surrounding the month of the 65th birthday. So in this example, we have somebody born in April. Their initial enrollment period would begin in January and would end in July. So it includes the 3 months before, the month of the birthday, and then the 3 months after. Now, if you're collecting your Social Security benefit as your 65th birthday approaches, you don't actually have to apply for Medicare. You'll get your Medicare card in the mail about 3 months before your 65th birthday. But if you're not collecting Social Security, then you will need to apply through the Social Security Administration. You can do that without starting your Social Security benefit. Once you have both Medicare Part A and Part B, you can join whatever other plans you want. But first, you have to join Medicare. If you sign up in one of the 3 months before the birthday month, then your coverage begins on the first of your birthday month. If you sign up in your birthday month, it will become effective the first of the following month. If you sign up in the month after that, it will become effective the first of the month after you sign up. So that is the initial enrollment period. Now, some people are going to work past 65, and they have coverage through their employer, through their active employment, or their spouse is working and they're on the group coverage of the working spouse. Those people can delay. They could go ahead and sign up for Medicare Part A because it's premium free, but they may just sign up. They may want to wait to sign up for Medicare Part B because you pay a premium. And then when they retire or the coverage ends, they get a special enrollment period to sign up for Medicare without penalty. However, if you don't sign up during your initial enrollment period and you don't have coverage through the active employment of yourself or your spouse, then you have to wait till a general enrollment period, which runs from January 1st through March 31st each year, and your coverage will become effective the first of the month after you sign up. The problem is you'll have to pay a late enrollment penalty for the rest of your life. So Unless you have coverage through active employment or the active employment of your spouse, you need to sign up during your initial enrollment period. Once you have Medicare, there are other opportunities to change your coverage. Every year from October 15th through December 7th, you have an opportunity to sign up for whatever other plans you want, drug plans or Medicare Advantage plans. You can change your coverage, and those changes then will become effective the first of the following year. We also have what they call special enrollment periods. And people who have worked past 65 will get a special enrollment period to sign up for both Medicare and whatever other programs like drug coverage, Medicare Advantage they want. You also, if you, these plans will have a service area where they're offered. And if you move out of the plan service area that you're in, then you get a special enrollment period to change to a different plan. If you have coverage through your employer or some other source and you lose that coverage, you get a special enrollment period. Also, if you move into or out of a residential care facility, the reason they do that is because those facilities usually have one pharmacy that they use for all their medications, and they give you an opportunity to change your drug plan, especially, or your drug coverage if need be. People who qualify for government financial assistance are allowed to change plans one time per calendar quarter. So, I want to talk about the parts of Medicare. There's a handout that you may want to download from the chat, and this shows the two different paths that you can take to get your Medicare. At any given point in time, you have to pick one path or the other. Now, from 1966 up until about 1997, original Medicare was the only way you could get your coverage. Original Medicare consists of Part A, which is hospital insurance, and Part B, which covers other medical services. People in original Medicare have to sign up for a separate plan through a private insurance company that only covers their prescriptions, and people in original Medicare don't have any cap on their out-of-pocket costs unless they purchase some kind of a Medicare supplement or Medigap policy. Now, in 1997, as you know, managed care was becoming more common in the workplace, Medicare introduced what's called Medicare Advantage or Medicare Part C. Medicare Advantage plans are plans through private insurance company. So if you choose Medicare Advantage, then the government doesn't pay the bills anymore. Instead, they give the insurance company you pick a set amount of money each month, and then the insurance company has to take over the responsibility for providing all of your Medicare Part A and B services. And it typically will include your drug coverage as part of the package and may offer some other benefits that Medicare does not offer as well. At any given point in time, you have to pick one path or the other, but you can go back and forth during enrollment periods. To talk a little bit more about Medicare Part A, original Medicare Part A, first of all, it covers hospital services, inpatient. If you're admitted to the hospital, that's covered under Part A. If you go to the emergency room, they don't admit you or they keep you for observation, that's Medicare Part B. But inpatient hospital stays are covered by Part A. Blood after the first 3 pints, Medicare Part A covers that. A stay in a rehab or skilled nursing facility for up to 100 days, if you just came out of the hospital, would be covered by Part A. Hospice is covered by Medicare Part A, and home health services can be covered by Part A if you just came out of the hospital, but it can also be covered under Medicare Part B if your doctor says you're not able to go in to get physical therapy, for example. So now you have some out-of-pocket costs with Part A services. Most of us do not pay a monthly premium for Medicare Part A. If you worked 10 years or more in a job where they withheld Social Security or your spouse did, you should be eligible for premium-free Part A. But there are some people who don't have that work credit, who do have to pay a premium. Now, if you're admitted to the hospital, you have a deductible that you owe on the first day of admission. In 2024, that deductible is $1,632, but that's all you would owe for a hospital visit unless you were in there more than 60 days. If you're in the hospital more than 60 days, then on the 61st day, you have to start paying a very steep daily copayment. It's over $400 a day, and it doubles after 90 days. So it doesn't happen very often, but potentially pretty steep costs with Medicare Part A. If you go into a rehab facility, then the first 20 days, there's no charge, but days 21 through 100, they charge a little bit over $200 a day. So again, you can see there are potentially, with Medicare Part A services, some large out-of-pocket costs. There is financial services assistance available for people who qualify based on income and resources. Medicare Part B covers other medical services. Most of the services you'll use. It would cover doctor visits, covers outpatient services of all kinds, outpatient surgery, tests like MRIs and CAT scans, covers durable medical equipment like wheelchairs and walkers, and supplies like oxygen and diabetic test strips. Medicare Part B covers preventative services, many of them with no charge, because they want you to get the preventative services. And again, if you go to the ER, that would be covered under Medicare Part B. Now you have some out-of-pocket costs with Medicare Part B also. Most of us in 2024 will pay a monthly premium of $174.70. There would be some people with a very small Social Security benefit that might pay less, because there's a law that says they can't increase your Part B premium in any year by more than the Social Security cost of living. So some people haven't caught up yet. And then very high income people will pay more. There is also a deductible, which is $240 this year. So anytime you go to the doctor or to other provider for Part B services, if they're a Medicare participating provider, Medicare tells them how much they're allowed to charge for that service, and they have to accept that amount. First couple of times you go in the year, you have to pay what Medicare allows the provider to charge until you have satisfied the deductible. After that, then Medicare will pay 80% of the allowable charge, and you will pay 20% for the rest of the year. Now, as you could clearly see from the discussion of these costs, they're potentially pretty large, and there is no cap on them unless you purchase some kind of a policy from a private insurance company called a Medicare supplement or Medigap policy. And there are different policies, but this will cover some or all of the normal patient responsibility for Medicare covered services. Anyone who is in original Medicare can sign up at any time for a Medicare supplement policy. You don't have to wait to some kind of an enrollment period. You can sign up anytime as long as you're in original Medicare. If you're in a Medicare Advantage plan, you have to return to original Medicare before you would be able to sign up for a Medicare supplement plan. There are different types. The government has created standard packages to make it easier to shop. for Medicare supplements, and all of them are required to cover four basic things. They have to cover the co-payments or co-insurance that you would incur in an inpatient hospital stay after 60 days. They have to cover co-payments with hospice if you actually go into a facility. They have to cover the Medicare Part B, the 20%, and then they have to cover the first 3 pints of blood. So other out-of-pocket costs will be covered by other some plans, but not all. The most comprehensive plan that someone turning 65 after January of 2020 can purchase is a G supplement. And a G covers all of the out-of-pocket costs except for the Medicare Part B deductible, the $240. Covers everything else. So there are other packages that are less expensive that would cover less. The key is that the coverage is identical regardless of what insurance company you buy your policy from. A given policy will cover all of the same things regardless of what insurance company you're working with. So generally, you're going to shop for Medicare supplements based on price, the premiums, because coverage is exactly the same, and it doesn't make a lot of difference as long as the company is stable and financially stable. Then it doesn't make a lot of difference because they don't make any decisions about what gets paid and what doesn't get paid. The government makes those decisions. So now you can sign up for a Medigap policy anytime that you're in Original Medicare, but for the first 6 months that you have both Medicare Part A and B, you have a guaranteed issue right to purchase that policy at the standard rate, and the insurance company can't turn you down because of any health problems that you have. But if you wait more than 6 months and try to buy a policy later, and you've developed some serious health problems, you may not be able to get a policy. So ideally, if you're going to be in Original Medicare and want a supplement, the best time to buy is during your initial Medigap open enrollment period, which is the first 6 months that you have Medicare. So that's Original Medicare. Now we want to talk about the alternative, Medicare Advantage or Medicare Part C. So again, these are plans that are offered through private insurance companies. They have to cover all of the same kinds of Medicare Part A and Medicare Part B services. They have to be approved by CMS as being the equivalent of Original Medicare. And they usually include the drug coverage as part of the package. With an HMO or a PPO, you have to use the drug coverage that's provided by the plan. You can't enroll in some other drug plan. So you can't have a Medigap or Medicare supplement policy. If you have Medicare Advantage, it wouldn't pay. These policies typically will have a network of providers that you either have to use in the case of an HMO, except in an emergency, or that you will want to use for lower co-payments if you're in a PPO. PPOs offer the ability to go in or out of network, but you pay more if you go out of network. So there are 4 main kinds of Medicare Advantage plans. The most common is what's called an HMO or Health Maintenance Organization. With an HMO, you typically have to have a primary care provider, and you need a referral to see a specialist. You have to use network providers except in an emergency or an urgent care situation. Health maintenance organizations typically provide the lowest copayments and the most generous package of extra benefits, things such as dental, eyewear, hearing aids, gym memberships, things of that sort. They will have more in an HMO usually than a PPO. But the PPO, preferred provider organization, will give you more flexibility. You'll have more doctors to choose from, and you will have the option of going out of network and paying a higher copayment if you prefer to do that. However, even with a PPO, it is much, much more expensive to go to a hospital or a rehab facility or a home health agency that is not in your plan's network. So in picking a PPO, you should be aware of what hospitals and so on you would have the ability to see on an in-network basis. We also have what they call special needs plans. These are mostly HMOs, but some of them are PPOs, and they are restricted to certain kinds of people. They are designed to meet the needs of that group, and there are different types. There would be special needs plans for people who had both Medicare and Medicaid. There would be plans for people who live in a facility, an assisted living facility or a skilled nursing facility. And there would be plans for people who have certain chronic or disabling conditions. We also have what they call private fee-for-service. These are very rare, but we do have them, and they operate a lot like original Medicare. With a private fee-for-service, the insurance company designates an amount that they'll pay a provider and a copayment that you'll be responsible for, and you can go to any Medicare provider that will accept those terms. The plan may have a network, but you're not obligated to use the network providers. The plan may or may not provide drug coverage. If it does not provide drug coverage, you have the option of signing up for a Medicare Part D drug plan, which you do not have with an HMO or a PPO. So, drug coverage was not always offered to Medicare beneficiaries. Prior to 2006, people on Medicare just had to self-insure for their drug costs. But a law was passed, the Medicare Modernization Act in 2003, that extended drug coverage to Medicare beneficiaries. But it was decided that the government wouldn't cover the drugs directly. Instead, they'd provide funding, but the plans would be provided through private insurance companies, either as a separate standalone Part D plan for people in original Medicare or as part of the package for people participating in Medicare Advantage. It only covers prescription medication. There are certain categories of prescription medications, such as drugs for fertility and erectile dysfunction, for example, that drug plans are not allowed to cover. It's mostly pills, but also certain injected medications that you would take at home, such as insulin. And in that case, it also will cover supplies for the administration of those drugs. Part D plans will cover some vaccines. Some are covered by Medicare Part B, but many are covered by Medicare Part D. There's a handout, another handout that you may want to download from the chat that has some of the points about each one of these topics that we're discussing here. Now, you have out-of-pocket costs with your drug plan. Depending on what plan you're in, you may or may not pay a premium. Most of the Medicare Part D drug plans with original Medicare do charge a monthly premium. There is one plan that is zero premium, but most of them will, the premium will range somewhere between $30 and $60 a month. The medications you take will determine what drug plan will be most cost effective for you. The plans may or may not have an annual deductible. In 2024, the deductible can't be more than $545, but some plans have a lower deductible, and there are some that don't charge any deductible at all. You will have either a copayment, which is a fixed amount, or co-insurance, which is a percentage of the cost that you will pay when you pick up the medication. Now, you also have a concept called the coverage gap or donut hole, where the amount you pay will change. And then we have a concept of catastrophic coverage. And if you get into catastrophic coverage starting this year, you don't pay anything. So if you've paid $8,000 in the year, then you would go into catastrophic coverage. So this slide shows the different phases that you may go through during the course of the year in a Medicare drug plan, whether it's a freestanding plan with original Medicare or the drug coverage offered by your Medicare Advantage plan. They all operate in a similar fashion. If your plan has a deductible, you start out in the deductible phase. During the deductible phase, you may not pay any more than you will later on for tier 1 and tier 2 generics, but you will typically have to pay the whole cost for the brand name medication, and you may pay more for some of the generic medications. Once you've satisfied your plan's deductible, then you go into what we call initial coverage. When you're in initial coverage, what you actually pay for your medication will be determined by what tier or level of coverage that drug has been assigned in your plan's formulary. If your drug is not in the formulary, then you would have to pay the full price of the drug. Plans don't have to cover every medication. They just have to cover a certain number of medications for each medical purpose. Now, the tiers, the higher the tier, the higher the copayment or co-insurance. A tier 1 would be a preferred generic drug. It might be free or might charge you a $4 copayment, something like that. But the higher tiers, you may pay like 30–40% of the cost. Now, it won't work out this way for you as an individual, but if you would take everyone in the plan and combine them, then during initial coverage, the plan is paying 75% of the cost and the beneficiaries are providing 25%. Now, once the total cost of your medications, including everything you've paid and everything the insurance company has paid, once that reaches a set amount, in 2024, that amount is $5,030. If it ever does, the cost ever does get that high, then you go into what we call the coverage gap, sometimes referred to as the donut hole. Now, in the early days of Part D, this was a disaster when you got in the donut hole because you had to pay the entire cost of the medication. But under the terms of the Affordable Care Act, over the years, we've been getting an increasing discount from the manufacturer on both the generic and the brand name medication. And it's reached the point now where when we're in the coverage gap, we pay exactly 25% of the cost for both the generics and the brand name medications. The manufacturer is providing a 75% discount on the generics and a 70% discount on the brand, and the insurance company is kicking in 5% on the brand name medication. Now, when what's called true out-of-pocket costs reach a certain amount, that amount in 2024 is $8,000. when true out-of-pocket costs reach $8,000, you would go into catastrophic coverage and pay nothing after you got into catastrophic coverage. In calculating true out-of-pocket costs, they give you credit for everything that you've actually paid up to that point in the year out of your own pocket, plus anything that some other individual or organization has paid on your behalf. And you also get credited with the 70% discount that is provided by the manufacturer on the brand name medication only. You don't get credit for the 5% that comes from on the brand name that comes from the insurance company, and you don't get credit for the discount on the generics, just the 70% on the brand name medication. And again, once you get into catastrophic coverage, you don't pay anything. So this is a convenient place to stop and see if we have any questions in the chat or any other questions that anybody would like to ask at this point. We'll have another opportunity later.
We don't see any questions in the chat, but if anybody participants wants to raise their hand, there's a little thing on the bottom of the screen that will say raise hand. If you click that, I will let you ask your question directly at this time.
Okay.
So let me give you a few seconds to see if anybody has.
All right.
No one has raised their hands, but you will get another opportunity later, so don't worry.
Right. Okay, very good. We'll move on then. So how do you enroll in Medicare? Well, it's important to distinguish enrolling in Medicare itself versus signing up for plans. So again, if you're collecting your Social Security benefit as your 65th birthday approaches, Social Security will automatically enroll you in Medicare and you'll get your card in the mail. But if you're not collecting Social Security, then you'll need to apply for most people through the Social Security Administration. And then you'll receive your Medicare card and you'll have a Medicare number and you'll be able to enroll in whatever other coverage you want. If you want to join a Medicare Advantage plan, once you have your Medicare number, you can do that. Or if you're going to remain in original Medicare, you can sign up for a drug plan. And if you would like, you can enroll in a Medicare supplement plan. Again, none of this will become effective before the first day of the month of your 65th birthday. Now, you should, before you make a decision about whether you want to be in original Medicare or Medicare Advantage, or before you choose any coverage, you may want to make sure that you have a good understanding of these two approaches. And you can give us a call at Shine. We'd be glad to answer any questions you may have and walk you through the process. You can also use the Medicare.gov plan finder. We use this quite often to help people find drug plans and Medicare Advantage plans, and anyone can use this. If you've never done it before, I would suggest that you may want to call us at Shine and we can give you a little tutorial so that you get the most information that you can. So again, when you're new to Medicare, you're going to choose either original Medicare with a drug plan and a Medicare supplement plan, or you're going to want to choose a Medicare Advantage plan. And we can help you with either one of these things. Once you've signed up for Medicare through Social Security, you can sign up for other coverage on the Medicare.gov website, or you can contact the plan itself. So again, you can call us at Shine. We'd be glad to help you. You can go to Medicare.gov, click on Find Drug and Health Plans, and enter your medications and so on. Look at all the plans that are offered in your area. You can call Medicare, 1-800-MEDICARE. And if you know the plan that you want to enroll in, you can call the plan directly or go to the plan's website. So I want to talk about financial assistance programs, government programs that help with some of the Medicare costs. First, we have what we call Medicare savings programs. These are a limited form of Medicaid, and like all Medicaid, the funding is shared jointly between the federal government and the state government. Every state has Medicare savings programs, but the eligibility may be a little different from state to state. Eligibility is based on your gross monthly income. So if your income is Social Security, that's the amount before they take out for Medicare Part B. And then also your resources have to fall below a certain level. Now, in counting resources, they don't count your house and they don't count one vehicle. But they do count bank accounts, CDs, IRAs, 401ks, anything like that that you have. So again, to qualify, you have to have income and resources that meet the limits. Application is made through the Department of Children and Families of the state of Florida or Access. A lot of people, the website is Access. And so you can apply online through Access. You can call us at Shine. We can help you see if you're qualified, and if so, we can help you with the application process over the phone. Now, if you qualify for Medicare savings programs, the state will pay your Medicare Part B premium for you. That's the $174.70 that comes out of your Social Security check for Medicare Part B. The state will pay it, which will give you an additional $175 a month. If your income is below the poverty level, then you qualify for a highest level of Medicare savings programs, which is called QMB, or Qualified Medicare Beneficiary. And a QMB, if they were not only will the state pay the Part B premium, but if you were not already eligible for premium-free Part A, the state would pay that as well, and it would excuse you from having to pay the normal out-of-pocket costs with your Medicare or your Medicare Advantage. So it's very helpful to people with very limited income. The other program that we screen for is called Extra Help with Prescription Drugs, and it does just what it sounds like. It helps with the drug costs. Anybody that qualifies for Medicare savings programs will automatically qualify for extra help, and the state will enroll them. They don't even have to apply through the federal government. Extra help is also referred to as LIS, or the low income subsidy. And again, eligibility is based on income and resources. Now, you can have higher income and higher resources and qualify for extra help than you would have to qualify for Medicare savings programs. So if you qualify for extra help with prescription drugs, what happens is the federal government, gives whatever insurance plan you're in that has your drug coverage extra money, and then they charge you less. So the government will pay the cost of a premium for your plan up to the state benchmark amount. If some people will choose to enroll in a plan and pay the difference in premium in order to get all of their drugs in the formulary. But often your drugs will be in the formulary without paying any premium at all. It also, if you qualify, it will limit your co-payments to no more than $4.50 for a 90-day refill of any generic medication, and no more than $11.20 for a branded medication, as long as the medication is in the formulary for the plan and you use a pharmacy that is a network pharmacy, then the extra help determines how much you pay for your medication. You also, if you qualify for extra help, they allow you to change plans one time per calendar quarter. The reason they do that is because if you get new prescriptions, you may need to either get a formulary exception or switch to a different plan so that extra help will cover your medication. So there's a handout that you may want to download from the chat that shows the current financial eligibility for both of these programs. On the left-hand side is the eligibility for the Medicare savings programs that pays the Part B premium. On the right is the eligibility for the extra help with prescription drugs. So before we close, I want to talk briefly about Medicare fraud and abuse. So the Department of Health and Human Services, the Administration for Community Living, has a program called Senior Medicare Patrol, or SMP. In Florida, SHINE has the contract to provide the Senior Medicare Patrol services. So SHINE counselors can provide the SHINE services as well as help to prevent, detect, and report Medicare fraud and abuse. So Medicare fraud is when a provider purposely or knowingly bills for services that were never provided or bills at a higher rate than they know is justified by what they did. Abuse is the same kind of thing, but when it's not necessarily done on purpose. So the difference between fraud and abuse is intent. It's important to prevent, detect, and report Medicare fraud and abuse. You prevent it by protecting your Medicare numbers, making sure that you don't give them to some scam artist that calls you up on the phone. You detect fraud and abuse by looking over your claims notices. And if you find something funny, you should check it out. You should report it. See if it's something that needs to be pursued. Now, every year, Medicare loses an estimated $60 billion due to fraud, errors, and abuse. So a few years back, Medicare generated new Medicare cards with a Medicare number that is a random combination of numbers and letters. In the old days, the cards were based on your Social Security number, but unfortunately, people may have your Social Security number, and that made it pretty easy for them to commit fraud. So as your 65th birthday is approaching, if you're collecting your Social Security benefit, make sure that Social Security has your correct address because that's where they're going to mail your Medicare card. You will need to give your card to providers or to, you'll have to share your number with insurance companies if you're enrolling in an insurance plan. But again, there are all kinds of scam artists out there that will call with offers of extra benefits. They may ask you if you've got your new plastic Medicare card, but there is no such thing. So be very, very careful about giving anyone that you don't positively know and who has a purpose your Medicare number. You should look over your claims notices. Don't just shove them into a drawer, as some people unfortunately do. Look them over and make sure that all of the claims that have been billed to Medicare or your Medicare Advantage or your drug plan are for items that you did receive. If you are in original Medicare, you get what's called a Medicare summary notice every 3 months in the mail. You can get it electronically. You can create a Medicare account and be able to see your claims quicker because 3 months is a long time. If you're in a Medicare Advantage or a drug plan, you'll typically get an explanation of benefits paid on a monthly basis. But the key is look it over, make sure that everything is on the up and up. So with a Medicare summary notice or an explanation of benefits, you have certain key things that you're going to look for. The name of the provider for a start. Now, it could be, if you see a provider that you don't recognize, it could be innocent. It could be that you had a biopsy and you don't know the name of the pathologist, or you had a surgery and you don't know the anesthesiologist, but it needs to be investigated if you don't recognize the name of the doctor. You want to look at where the service was provided, whether it was approved or not, the amount the provider charged, the amount Medicare approved, and it will tell you how much you may be billed. A lot of times providers will start out billing for the entire amount, but wait till you see what Medicare tells you you owe before you pay, unless you know you have a set copayment, you know what it is. Look at the date that service was rendered and where, and also check for double billing, make sure that nothing appears more than once. And if a service is denied, there will typically be a code that will be a footnote, and you'll be able to see the reason for the denial of the service. If you see something unusual, you should report it. You can call the insurance company, you can call Medicare, you can contact us at Shine. If someone calls you up asking for your Medicare number, don't give it to them. You may even want to disclose the attempt to the Federal Trade Commission at the number you see on the screen, 1-877-382-4357. If you believe that you are the victim of fraud or abuse, then you can contact us at Shine, and we can help you sort it out and see what you need, who you need to contact to report it. You could also call the local authorities. So that concludes the presentation. I would be glad to take any questions that you might have at this point.
So Jim, thank you so much. I do
welcome.
have a few questions. And again, I just want to remind the participants, if you raise your hand on the bottom, we'll let you ask your question as well. My first question has to do with supplemental plans. So does the supplemental plan cover the drug out-of-pocket costs or not?
Well, it depends on what you mean by supplemental plans. Strictly speaking, Medicare supplement refers to the policy that you buy if you're in original Medicare. But people often confuse the terminology, and they will refer to their Medicare Advantage plan as a Medicare supplement. It's really not a supplement. It is your Medicare.
Right.
Now, with original Medicare, the Medicare supplement policies that you buy they are not permitted to cover any of the costs of Medicare Part D drugs. That is only, the Part D coverage only comes from the drug plan in original Medicare. Now, some medications, though, medications that are infused or injected at a doctor's office are covered under Medicare Part B. And if you have a supplement, it will cover or it may cover, depending on what supplement you have, the expense that you have for an injected or an infused medication at the doctor's office. Now, with Medicare Advantage, the Medicare Advantage plan covers all of the drug benefits. There are co-payments with either, and so the plan itself will not, none of the plans will cover the copayment that you have for the medications, for the Part D medications. But again, if you have a supplement, then the really expensive Part B, like infusions, that you get in a doctor's office would be covered by a supplement. So,
Thank you.
mhm.
So if you are turning 65 and you maybe are still working but don't have an employer coverage, how do you pay for Part B if you're not taking Medicare yet, or you're not taking Social Security yet? So is there a
Okay.
way, how does that work?
Well, many people these days are waiting till age 70 to take their Social Security benefit so that they maximize their Social Security benefit. In that case, you have to make other arrangements. They will bill you, Medicare will start out billing you for the Medicare Part B premium, but it tells you how to make arrangements to pay by a direct bank debit or apply it to a credit card. But you do want to have some kind of you could wait and pay I think they bill you on a quarterly basis. You could pay it that way, but most people, I suggest, set it up on some kind of auto pay. And then when you start collecting your Social Security benefit, it will come out of your Social Security.
Great, thank you.
Mhm.
So if you were to, well, I understand that, HMOs, when we're talking about Advantage plans, are really geographically limited. But if you were to be in traditional Medicare and purchase a supplement policy, but then moved into a different state, would you have to get a new supplement provider? And at that point, would you have to meet the medical underwriting criteria if it's been longer than that 6-month period?
No, typically you can keep your same policy, even though it may not be marketed in the state you've moved to. Generally, you contact the insurance company that has your Medicare supplement policy, and you inform them that you've moved, and they may adjust your rate up or down based on medical costs in the area that you've moved to. But typically, you do not have to change your plan. If for some reason your carrier would not insure you in that state, you would have a guaranteed issue right to enroll in a supplement where you had moved.
Oh, great. Thank you.
Mhm.
I don't see any other questions. Just give y'all one more minute if you want to raise your hand. So if you would, then I can put your mics live. Just let me know. Give you about one more minute. But thank you so much. This is, as someone who's getting close to this point in their life too, this is so very helpful. I had no idea that you had to go 3 months in advance and start doing
Yeah.
all of that. So that's really important information for me personally. Thank you.
Well, yeah, don't wait until the last minute with Social Security, because you need to have your Medicare card by the first day of your birth month, and in order so that you can sign up for other coverage. And Social Security asks for 3 months to process your application for Medicare. So they'll make your Medicare effective on the first day of your birthday, but if you call them at the last minute, you may not, you won't have it in time. So again, we're very happy to help anyone with their Medicare or Medicaid issues, and you can reach us at our toll-free number, which is 1-800-96-ELDER or 1-800-963-5337. And the senior, you can also contact us at the Senior Connection Center. You see the telephone number for the Senior Connection Center there. And the Shine, the state has a statewide website for Shine. You can go there. A lot of information about presentations and other activities in the counties that we serve. There, if you like, there is a survey that you can take to give us feedback on the presentation. You see the you know, the URL there to take the survey on the screen. And I thank you for attending. And again, if there are any final questions, be happy to answer them. Otherwise, have a good day.
I don't see any. Thank you so much for our participants. You will be receiving a follow-up email with the, and you will, those of you who are going to be getting the incentive from Advent Health on the Grubhub, that will be coming directly from them. So keep an eye out for that. If you see some kind of unusual email relating to Advent Health or Grubhub, that's probably what it is. So I just wanted to alert you to that. So there is a gift certificate coming for those of you who participated today. And this finalizes our series of health access workshops that we've had throughout this year. And we do thank you all for participating and hope that you have some valuable information to take away and make life better, or at least learn what new questions you need to ask.
Okay, well, thanks for the opportunity and have a good day.
Thank you, everyone. Have a great rest of your day.